We've all been there. You're in public doing everything you can not to lift your arms because you have sweat marks in your armpits. It's always embarrassing when it happens, but imagine it happening to you every day because of excessive sweating. If topical treatments aren't working for you, you might want to inquire about Botox. That's right, Botox. Here to tell us how it works is cosmetic surgeon Dr. Rokhsar. Dr. Rokhsar, thanks for coming back on the show. So Botox, I guess it's not just for wrinkles anymore, huh?
Yeah, Botox is not for wrinkles. Botox was actually developed for medical purposes originally, for to make the tension in muscles better, to relax muscles. And now the indications have really increased throughout the years, and one of the relatively new indications is treatment of hyperhidrosis or excessive sweating.
So before we talk about where you can use it, tell us a little bit about excessive sweating. What exactly constitutes that problem?
Sweating is mediated by the sympathetic nervous system, so it's under nerve control, and it's in our fight and flight mechanism. And the sweat glands in our skin are innervated by these nerves that produce produce sweat. So you're basically disrupting that signal from the nerve to the sweat gland to basically decrease production of sweats with Botox.
And so obviously if you suffer from that, it can be very disruptive socially, even professionally, correct?
Exactly. And excessive sweating, we define it as sweating that not only is socially and professionally disruptive, but also sweating that's not well controlled by antiperspirants or deodorants, and even prescription ones, which are available.
And so how does the Botox work? I mean, I understand the places you use it to treat are underarms, right? Palms and feet, is that correct?
Those are the three common areas, hands, palms, and axilla, or armpits. And Botox disrupts a signal from nerve to muscles or from nerve to sweat glands, and as such it works that way.
And it lasts, what, about 3 or 4 months?
For wrinkles, Botox lasts for about 3 to 4 months, when we inject in the face, in the glabella, forehead, or crow's feet. For sweating, it actually lasts twice as long, which is nice. It can last 6 to 9 months.
That is nice. That is nice. And where do you find most people who come in to get this procedure done? Are they doing it for underarms or for palms? I'd imagine palms, it's a very serious issue, especially professionally, or...
The most common area people do is still armpits.
It is, okay.
But palms is definitely probably one of the most problematic areas for patients, because it is truly disruptive for patients who really, truly sweat in their hands. So there are people that truly drip in their hands, and it really disrupts their lives, and Botox is a really nice treatment.
So you've seen this really help a lot of people?
Very much so.
You're doing the procedure a lot these days?
Yeah, we do at least a few people a week,
right.
And it's got extreme high patient satisfaction rate, because previous to this, there really was nothing available. There was very invasive surgical procedures to actually disrupt the nerves, which had morbidity and downtime. And so really, this has revolutionized the treatment for this condition.
A huge improvement, huge improvement. And why does it last longer? Why the 6-month rate rather than the 3 to 4 months that?
That's a good question. I don't think we know the answer to that, but clinically that's what it is. For wrinkles, it only lasts on average 3 to 4 months, but for sweating, it lasts about 9 months.
And what is the cost per procedure?
The cost for sweating, for treatment of sweating, is a little more than treating wrinkles, and that has to do with the fact that we actually have to use more of the material in order to cover the surface area that we're treating. Exactly.
Okay.
And so that's what the cost is. The cost is anywhere from $1,000 to $1,500 depending on what area is treating and how much Botox you're injecting into that area.
Now, is there any danger to this? I mean, your body is naturally releasing, it is a natural process. Is there any danger to stopping that process?
Not at all, because sweating is really mediated at a local level. The glands are in specific areas in the skin, so if you're disrupting the production of sweat glands in that area, it's really not having any immediate or long-term effect on sweat production anywhere else on the skin.
So it's not forcing you to sweat more other places?
No, not at all.
Oh,
that's not the case.
Okay, great. Well, very interesting treatment for use of Botox. I'm sure a lot of people will be happy to hear about that. Dr. Rokhsar, thank you so much for joining us today.
Thanks a lot, Tanya.
And for more GMA Health, be sure to check us out on all of our mobile providers.
ABC News Now. Good to know.